10 from 11 to 20 basic terms and their definition of the clinical anatomy. So over here, number first, we have got pyrexia. Pyrexia is actually a medical term used for fever. So in general term, we say I have got fever, but in the medical sense, you are not able to say that. You're supposed to say pyrexia, which actually means the fever. Another one we have got the lesion. So lesion means actually injury or a circumscribed pathological change in the tissue. So it should be easy to understand. If I write injury beside it, lesion means injury, for easy to understand. And the inflammation, in the case of inflammation, you should be telling, so it's actually the local reaction of the tissue to an injury, like the reaction of the tissue to the injury, or an abnormal stimulation caused by physical, chemical, or biological agent. So this is the definition of inflammation. Be specific. It's the reaction of the tissue. So inflammation is actually the reaction of tissue. So there are a few other characteristics that are related to the inflammation. So in inflammation, you get swelling, you have pain, you have redness to that area, you have warmth or heat to that area, and loss of function. So 5 things are included in the inflammation. The characteristic, you might say, we have got swelling, pain, redness, warmth, and loss of function in that area. So these are the characteristics of the inflammation, which means reaction of a tissue. Another definition, we have got the edema. So what is edema? Is actually swelling due to accumulation of the fluid in the extracellular spaces. So you might say that swelling due to accumulation of fluid, in extracellular fluid, extracellular space, or should I say ECS for short. Again, let's move towards the thrombosis. So what is thrombosis? So thrombosis is actually the intravascular coagulation, or you can say solidification of blood. Intravascular coagulation, or you can say the solidification of blood. So I would rather say intravascular coagulation. Intravascular coagulation of blood. All right. And in the case of embolism, which is number 16, so the embolism, or you can say is occlusion of vessel by detached and circulating thrombus, embolus. Like if we have got the thrombus, and when thrombus that detaches from that area and move in the circulatory system and again is stuck somewhere else, so we call that thing as embolus, and this is called embolism. So you can say occlusion of a vessel by detached and circulating thrombus, or you can say moving thrombus. So this is pretty clear. And now moving towards the hemorrhage. So hemorrhage actually means bleeding, which may be external or internal. So you can simply add up bleeding. If somebody is saying bleeding, you must understand in that medical term you are supposed to call it hemorrhage. But for the ulcer, the definition would be a localized breach. You can say gape or erosion in the surface continuity of the skin or mucous membrane. So for example, if I say I have got ulcer over here, so which means there is a breach. For example, I got ulcer over here, I mean there's a breach of my skin and my inner skin is exposed. So the proper definition is a localized breach or gap in the surface continuity of the skin, or because people get ulcer inside their body, so which means their skin is damaged or its internal part are exposed and to more harm. So ulcer is pretty clear. And now let's move toward the sinus. So what is sinus? Sinus is actually a blind tract, open at one end, lined by epithelium. So means it's a blind tract. It's leading nowhere. It has no further track. It ends somewhere. No, for example, there is an artery or something is coming, and in the end, it ends over here. So it has no path more than that. So you can call it the blind. You can say it's a blind tract, so open at one end, only one end. There is no path leading further. In the case of fistula, if we're talking, so fistula is actually an abnormal passage, usually between two internal organs or organ to the surface of the body, lined by the epithelium. So what is a fistula? An abdominal passage, usually between two internal organs, organ to surface of the body. So this is all about the fistula, which was easy to understand.